The Food and Drug Administration allowed emergency use authorization to the COVID-19 antibody created by Pfizer and BioNTech on Friday, denoting a critical achievement in the United States' fight against the fatal COVID. The approval implies a great many Americans will approach dosages of the immunization very quickly. However, the most readily accessible punches will go to bleeding-edge medical services laborers and high-hazard people. The FDA's approval followed a Thursday proposal from the Vaccines and Related Biological Products Advisory Committee, VRBPAC, comprised of virologists and other clinical specialists, which asked the FDA to make the Pfizer immunization accessible on a crisis premise. Here is the thing that we think about the Pfizer antibody, including how powerful it is, the way generally accessible it will be, who will approach it first, the amount it might cost, and whether it will end the pandemic. How successful is the corona vaccine? Contrasted in most immunizations, the Pfizer COVID antibody is very viable. The FDA has insisted Pfizer's finding that its immunization is 95% viable in shielding beneficiaries from getting contaminated with COVID-19. That is obviously superior to influenza antibodies Americans line up to get in a regular fall, which are all things considered 60% compelling. It was additionally as of late affirmed by the FDA that this adequacy incorporates forestalling serious cases, not simply mellow or moderate diseases. Similarly as significant, the immunization shows comparable adequacy across age, sexual orientation, and racial gatherings, in spite of the fact that Pfizer's preliminary subjects were excessively, 80%, white, so information might be inadequate. The first round of preliminaries did exclude beneficiaries under 16 years old, and the course of events of immunization endorsement for youngsters is right now hazy. What are the symptoms of the antibody? Extensively, the antibody has insignificant results, in light of a huge number of preliminary beneficiaries and thousands all the more previously accepting the immunization in the UK. Results can incorporate weariness, throbs, or influenza-like manifestations enduring about a day. There were 4 revealed instances of beneficiaries enduring Bell's paralysis, a regularly brief and non-dangerous loss of motion of facial muscles. However, the FDA has said those events were steady with the rate in everybody. Could the immunization trigger a hypersensitive response? Nonetheless, 2 British well-being labourers with a background marked by extreme hypersensitivities had genuine responses subsequent to getting the immunization. English well-being specialists are exhorting alert for patients with comparable accounts while they research how genuine the dangers may be. What number of portions of the antibody will be accessible after it is endorsed? At first, not many. Pfizer and United States authorities at present task that 40 million portions of the immunization will arrive at the United States before the finish of 2020. That is sufficient to give the 2-portion antibody to 20 million individuals, or 6% of the United States populace. Another 80 million portions, enough for 40 million Americans, will be accessible in 2021. But since the Trump Organization declined to secure extra inventory, no dosages passed that are required to be accessible until July 2021. Notwithstanding, this may not be as startling as it sounds, on the grounds that other immunization up-and-comers, especially Moderna's, are not far behind Pfizer's in the endorsement pipeline. Who will be qualified to get the immunization first? With scarcely any portions at first accessible, the Centers for Disease Control suggests organizing clinical staff and the occupants of long-haul care offices. However, conveyance is being taken care of independently by each state. The CDC has accumulated each state's antibody course of action here. What amount will the immunization cost? The United States government has paid Pfizer and BioNTech $39 per portion for the initial 100 million dosages, and Americans are required to pay almost no cash base to be immunized. Medicaid, Medicare, and most types of private protection will be needed by government command to take care of antibody costs for patients. Indeed, even uninsured patients should have the option to get immunized at low or no cost. A unique asset has been set up to repay suppliers for those shots. What's an emergency use authorization? The FDA gave the green light to the antibody on Friday by giving an emergency use authorization, or EUA. Urgently, this isn't a type of FDA endorsement, yet a thumbs up to utilize the antibody before it gets full endorsement. Pfizer should proceed with the cycle for full endorsement, including leading more preliminaries. What is the FDA assessing? The FDA approval followed the suggestion of the warning panel on Thursday. The Board of Clinical Specialists gave its suggestion in the wake of inspecting discoveries about the immunization's essential security and adequacy. The board on Thursday additionally examined optional ramifications of the crisis approval, including inquiries of how to proceed with randomized preliminaries after the crisis approval is endorsed. The issues were not an obstruction to the EUA. What is in the antibody? In contrast to most current antibodies, the Pfizer immunization doesn't contain material from the infection it's intended to obstruct. All things considered, it contains combined courier RNA, or mRNA, a sort of hereditary cheat sheet that mirrors COVID-19 science barely enough to prepare your body's invulnerable reaction to battle it. That mRNA is encased in a shell made of lipids, or fats, for conveyance. For what reason does the Pfizer immunization require 2 portions? Pfizer's antibodies require 2 portions, 3 weeks separated. This is basically to expand its adequacy. The FDA has delivered information indicating the antibody is to some degree successful after 1 portion, yet the 2 dosages are expected to develop full invulnerability. How long is the immunization viable? This is as yet unclear on the grounds that the antibody preliminaries were so later. The World Health Organization trusts the immunization is viable for at any rate a half year. Specialists addressing New Scientist anticipate that yearly supporter shots should be fundamental. Would you be able to in any case send COVID subsequent to being inoculated? Preliminaries for the Pfizer antibody estimated its security and its viability in forestalling side effects in people. It didn't decide if inoculated individuals could at present convey the COVID without indicating side effects. Mario Ostrovsky, an immunology teacher at the University of Toronto, disclosed to Canada's CTV News that we will possibly see whether immunized individuals can be asymptomatic transmitters if contamination rates stay high after a dominant part of the populace is inoculated. That implies that veils and social separating will remain the standard even after the antibody has arrived at a huge number of Americans. Will the antibody end the pandemic? In the long run, yet not right away. Regardless of whether the Pfizer immunization ends transmission just as manifestations, exceptionally irresistible sicknesses like COVID-19 require significant levels of resistance to break the chain of transmission that can keep an irresistible illness circling in a populace. For measles, which is additionally profoundly irresistible, that limit is 94%.